Hi, I'm Keisha. I'm going to be your nurse today. What's your name?
Dalton.
And how old are you?
15.
Alright, and you come in today for a head, face, neck, eyes, ears, nose, throat, and mouth assessment. If you have any questions during the assessment, let me know.
Yes, sir.
Alright, I'm going to clean my hands right quick before we get started. And I'm going to start by palpating your head. I'm going to feel for any lumps, bumps, or bruises. Do you have any tenderness while I push?
No, ma'am.
Okay, checking your hair. Your hair is nice, light brown, evenly distributed, clean. Checking your scalp. Scalp is nice and clean, no dandruff noticed, no lesions, no infestations noticed. Okay, can you look up? I'm going to move on to your face. Checking for symmetry. When I look at your ears, your eyebrows, your eyes, your nose, and your mouth, everything's nice and symmetrical on your face. Now I'm going to palpate your temporal arteries. All right, very good. Now I'm going to check cranial nerve number 5, which is your trigeminal nerve. If I can get you to open your mouth, close your mouth, and clench your teeth. Very good. Moving on to cranial nerve number 7, which is your facial nerve. I'm going to get you to smile and frown and puff out your cheeks. Squeeze your eyes. Very good. Okay, now I'm going to palpate your frontal sinuses and your maxillary sinuses. Very good. Okay. Moving on to your eyes, looking at your external structures, your eyebrows, your eyes, your eyelashes. Close your eyes. I don't see any bruising, any redness, no irritation, no drainage. Your eyebrows are nice and brown, eyelashes are nice and brown, evenly distributed. Okay, if I could get you to look up, checking your conjunctiva, and it's nice pink and moist. Looking at your sclera, it's nice and white. Your irises are nice, clear and blue. And now I'm going to check cranial nerve number. I need to check your corneas. I'm going to check your cornea. If you could just turn your head to the side. All right, nice and round. Nice and round. Now I'm going to check cranial nerve number 2, which is your optic nerve. If you could read this.
Alcohol prep.
Very good. Okay, now I'm going to be checking cranial nerves number 3, 4, and 6. Your oculomotor, your trochlear, and your abducens. If you could keep your head still and follow my pen using only your eyes. Very good. Can you look at the wall and back at my pen? Very good. Okay, now I'm going to check for pupil reaction. If you'll just hold your head still and look straight ahead. Nice and round and reactive. Okay, now moving on to your nose, I'm going to check your outer structures, your nares and your nasolabial folds are nice and even structure. I don't see any irritation, no sores, no redness. Okay, if I could get you to tilt your head back, I'm going to take a look inside. All right, your nasal mucosa is nice pink, nice red and smooth, and your septum is nice and midline. Okay, now I'm going to check for cranial nerve number 1, which is your olfactory. I need you to close your eyes and tell me what you smell.
Alcohol.
Very good. Okay, now I'm going to check for nasal patency. If you could, take one finger here, push in, breathe. Do the other side. Very good. Nice, clear patency. Okay, now moving on to your mouth. Checking your outer structures. Your lips look nice, pink and moist. No dryness, no sores, no fever, blisters, no cracking noted. Okay, if you don't mind, let me take a look on the inside. All right, looking at your gums. Nice and pink, no sores noted. Looking at your teeth, top and bottom. No dental caries noted. Looking at your tongue, no ulcerations, nice and smooth. Looking at your buccal mucosa, nice and smooth and pink on each side. Okay, could you stick out your tongue? All right, tonsils are nice and round and smooth. Okay. I'm going to put some gloves on right quick, and I'm going to check the inside of your lips and cheeks just to make sure we're not missing anything. I see that you have braces on tops and bottoms, so we're going to make sure there's no ulcers. All right, bottom lip. No ulcers, no redness, no irritation. No ulcers, no irritation there either. All right, all nice and clear, okay? Very good. Clean my hands. Okay, I'm going to check some cranial nerves. I'm going to check cranial nerve number 9, which is your glossopharyngeal cranial nerve. If you could swallow for me. Very good. And now I'm going to check cranial nerve number 10, which is your vagus nerve. Can you stick out your tongue and say, or can you say ah? Very good. Okay, and then I'm going to check cranial nerve number 12, your hypoglossal nerve. And I'm going to need you to stick out your tongue, move it side to side. Very good. Now can you say these words? Light, tight, and dynamite.
Light, tight, and dynamite.
Very good. Okay, now I'm going to move on to your ears. Looking at your ears. They are nice and symmetrical, and I'm going to check for any pain. Do you have any tenderness, pain here?
No, ma'am.
What about along here?
No, ma'am.
Very good. Okay, now if you don't mind, turn your head. I want to take a look inside. All right, no drainage, no bumps noted. Okay. No drainage, no bumps noted. Very good. Okay, now I'm going to move on to your neck. I'm going to check for to see if your trachea is midline. Your trachea is good midline. Now I'm going to move on to lymph nodes, and I'm just going to call them out as I palpate them. Pre-auricular, posterior auricular, occipital, submandibular, submental, jugulo-digestive, posterior cervical, superficial cervical, anterior cervical. And can you shrug your shoulders up for me? Very good. And supraclavicular lymph nodes. Okay, very good. And now I'm going to do a thyroid exam on you. Can you get up, stand up? Very good. I'm going to go behind you and tilt your head up. All right, tilt your head to the side. Very good. Can you swallow? Nice. Tilt to the other side. Can you swallow? Very good. No tenderness or enlargement noted to the thyroid.